Hi, my name is Jacqueline Cosgrove. I'm the health reporter at the Oklahoman. Today I'm joined by Dr. William Meyer. He's a pediatric oncologist at the Jimmy Everest Center at OU Children's. Thank you so much for joining us today.
My pleasure.
So today we're talking about pediatric cancer. I was hoping you could start out by talking about what are some of the cancers that you see and treat at the hospital?
The most common cancer that we see in children and adolescents is leukemia. Acute lymphocytic leukemia makes up about 80% of all the leukemias we see, and all the leukemias together make up about 25% of the cancers in children and adolescents.
Wow, and what kind of works out with the other cancers that you see?
The next most common as a group are brain tumors, and they comprise between 20 and 25%, but many different kinds of tumors. And then it's a smattering of sarcomas in bone and soft tissue, primary kidney tumors, a tumor that often starts in the adrenal gland called neuroblastoma, and then germ cell tumors beyond that. But beyond those top two, all of them are relatively uncommon.
Have you seen treatment change over time since you've been treating kids?
Things have dramatically changed in my lifetime. When I first started this, it was in the era that we were just beginning to understand combined therapy for acute leukemia, and the first cures were being reported with combinations of systemic chemotherapy and therapy directed to the central nervous system to prevent disease there. And at that time, the cure rates were 50 to 60%. At the present time, we're curing of all cancers, about 80% of all children and adolescents with cancer. And for acute lymphocytic leukemia, the cure rate is about 90%.
Wow. How do the different cancers present in different ages, like what you might see in like a 2 to 3 year old versus what you might see in a teenager?
For things like leukemia, it's most often that they have signs of bone marrow failure. They'll bleed or bruise because of low platelets, have fever or infection because they don't have enough white cells, or sometimes they present severely anemic with pallor because they lack red cells. For many of our solid tumors, the presentation is a lump or a bump somewhere. For our brain tumors, often it's change in neurologic function that brings the child to see us.
Okay. And I wanted you to talk about, something a little happier, survivorship. How many Oklahomans do we know are walking around survivors of a childhood cancer?
We estimate that about 1 in 800 adults is a survivor of childhood cancer. In Oklahoma, with a population of over 3.5 million, that puts our survivors at in excess of 4,000. Clearly, we still have a lot of work to go. We'd like to be a point where every child had a chance to be cured, and we could do that with minimizing the effects of their therapy. So we still have a lot of work to do.
Sure. Well, thank you so much for coming. We really appreciate your time. And if you want to learn more about the research that they're doing, visit the OU Children's website.